Well, hi everybody. It's Kim Winter from Logistics Executive Group. My pleasure to be with you again, talking to business leaders around the world. Today's session, I'm delighted to have a long-time associate, Dr. Ben Hanson, who hails currently from the Middle East, but Ben has operated from the UK, Australia, which I think Australia calls home, GCC, and throughout the GCC, Saudi Arabia, UAE, Oman, and you're currently running a practice here in Dubai. Welcome, Dr. Ben Hanson.
Thank you very much, Kim. It's a pleasure to be here today. I'm looking forward to our discussion.
Great. Thanks, Ben. And full disclosure, of course, to our audience, when I previously had contact with one of our guests, Ben was actually my GP back in Sydney 20-odd years ago. And believe it or not, I credit him with saving my life back in 2001. So, Ben, you're one of three people that I credit with saving my life.
Well, thank you. Well, it was definitely a good save.
Well done. And so, Ben, as per normal with our guests, I like to get a bit of a feel for your upbringing, your background, how you ended up getting into the medical field, and also what's taken you wide and deeply abroad with your medical profession. So maybe we start with the upbringing in Australia.
Sure, Kim. So I grew up in Sydney, in the southern and eastern areas of Sydney, and I have two other brothers. And my mother was a school teacher, and my father was a property developer, and they had a very happy marriage, and it was a very sort of stable childhood. Three boys, so it was very competitive. Even the dog was male, so it was we had it was very challenging in that aspect. My father was he was a very clever businessman and very optimistic, and he was always looking for opportunities. And even in the worst of times, he always managed to find the silver lining and to find an opportunity to do a business deal or a new project, and he never let any tough times get on top of him. I had that influence growing up to always be looking for where the opportunity is rather than focusing on what's the current situation now, no matter how bad it is.
So what was the segue between school time? So you're rural or you were a city guy?
So I grew up in the city, but my father was a property developer in the rural areas. So I spent a lot of time on farms and in the country as well. So all of my holidays were, on the farm with the horses, with the cattle, wearing gumboots, that sort of thing. Well, I certainly spent a lot of time in both locations. So actually, that sort of translated later in my life, where I bought some rural land and built a house and had my own little sort of getaway farm, which is mostly kangaroos and wombats. So I was lucky to have that upbringing and to have that business exposure at a very young age. I did do some work in my father's office. I mean, it wasn't really that much. He was trying to groom his children to take over the business without actually telling us anything about the business. And it was all terribly boring, just trudging over property, over land developments and blocks for sale, and the endless talking about councils and environmental regulations, and it was just like verbal Valium that just completely turned us off. So I knew that that's what I didn't want to do, which in hindsight I should have probably done. In Australia, I mean, really the only way one of the few ways to make money is in property. To really generate wealth, it's pretty difficult to make a buck in Australia otherwise. So medicine came about. I just found the subject was fascinating, and I actually really enjoyed the the idea of doing work that was meaningful and actually sort of giving back in your work, and also the close sort of personal connection that you get, that intimate connection in the job that you don't tend to get in too many other fields of work. So it's you have quite a special relationship with people in medicine, and I found that side of it, very appealing. Of course, my parents were not encouraging at all. So that was the last thing they wanted. To have their son at university for 7 years, doing something that was completely off their radar. But I mean, in the end, they came around. But it was certainly not like I was pressured into doing it. I was really pressured the other way.
Great. So I recall meeting you probably when I started this business about 1999, 2000 in Sydney. You had a private general practice, as I recall it, in one of the most eclectic parts of Sydney, and certainly one of the most eclectic parts of the world, I would imagine. I mean, anybody and everybody was living in Darlinghurst, and was quite a scene in those days. And I recall your practice, you were very well known in the city, and even though you're in private practice, I know that you used to take all comers, and anybody really in need you'd look after. So it was fairly dynamic times.
Yeah, they were good times back then. I didn't appreciate it at the time. I don't think we ever do. But the good thing back then was, you really could take all comers. You really could deal with the executive businessman and the Supreme Court judges, to the homeless people, to the schizophrenics, to the sex workers, everything. It was a complete mix of mums and dads, a few kids, not that many. It was a lot of fun in terms of people. I think the world has changed, and I think 20 years ago, people were more happy to be individuals and happy to be different, and that was not frowned upon. It was sort of almost encouraged, or it was viewed in a way that didn't have judgmental or negative emotions attached to it, or judgment from people. So I think it's a bit harder to be so individual these days in person. I mean, we see people behaving like that online, but in real life they're fairly bland. So it was nice to have a real mix of people. Whenever my friends got together, my parents people around me, I found it stimulating, and also I learned. It was great to learn from people of different backgrounds, not just countries and religions and races, but everything.
Okay, so you and I sort of disconnected from early 2000s. I was traveling around the world setting up this business, and in about 15 different places around the world, and we ran into each other a couple of years ago here in Dubai, and quite by chance, as a matter of interest. And you were telling me then, and I'd like you to tell the audience a little bit now about your travels internationally, what drove you around the world to the various places that you've worked, and what you're doing now in Dubai. And then I'd like to talk a little bit about the current medical situation that's going on where you're practicing.
So I always enjoyed traveling, and I've always done some sort of work or education in different parts of the world. After more than 20 years in business in Australia, where I was the owner of the business, as well as operating, as well as working in the business, I think everything just became too predictable. I really felt like I was a surplus to my own existence in a business sense. Everything was stable. The business was running well. The patients were stable. And the challenge had really got out. It really disappeared. So I actually was pretty keen to do something different, to really push myself, learn more about the world, do some more, use my skills on a bigger scale. And I came to Dubai. First time was 1998 on a stopover, and there was nothing here. The Burj Al Arab had been built. The Jumeirah Beach Hotel had been built, but it was like a small road through the desert to get out to those places. There was just nothing here. It was hot. It was boring. I was here for 12 hours, and I swore that I would never come back. I'd done it, ticked the box. I didn't see the purpose of the place. And then in 2013, I came here for a conference at short notice, or training course, and I loved it. It was vibrant. It was positive. It was dynamic. There was a lot of change. It was complete opposite to a lot of the Western countries where things have stagnated, and to try and do anything was a huge effort, especially to be innovative or to be entrepreneurial. It is very difficult because you get shut down in so many different ways. But here it was open, and I really found that interesting. I found the culture and the mix of cultures to be very interesting, and I really liked the positive spin in the media, that everything was always upbeat, it was always happy talk, even if it wasn't completely real at times. It was a nice change from being in that really negative Murdoch, News Corp, Fox environment, and not just, I'm not singling up that company, but really most of them. The UK is the worst, but Australia is not far behind in terms of the negativity. And it was actually nice to be somewhere where that you didn't have that negative brainwashing going on all the time. So I really loved it here, and it took me sort of 2 years of trying to move here, because it's, if you're coming as a highly skilled Western professional, it's actually quite difficult to get here in the healthcare field. It's very difficult. We're not the demographic that's actually in demand. So there was a lot of effort just to get here, and it's certainly been a challenge since I've been here.
So you established yourself here, but I know that you've worked right throughout the Gulf, Saudi Arabia, Oman in particular, and you've worked on a number of consulting projects. Of course, the healthcare space here is booming, has been all the way through the last 20 odd years or so. So you've been consulting to institutions, to hospitals, to medical organizations, setting up both on the clinical and the business side. Maybe talk to us a little bit about where the business meets medicine.
Sure. So obviously, this is a far more commercial system than Australia or the UK. It's much more based off the American system, but then it has its own twists. It's like a combination of an Indian and American healthcare model. My expertise has really been in terms of startup operations and turnaround projects, although I also assess currently stable operations in terms of improving efficiency, improving performance. My initial work was in Saudi Arabia. I was lucky. I was working for a very high-profile organization, one of the King's universities, and through that role, I managed to meet very high-profile people. Then I came to Dubai, and I was working for Miras, which is the private holding company of the ruler of Dubai, Sheikh Mohammed bin Rashid Al Maktoum, who's also the vice president of the UAE. And I was once again sort of thrust into a very senior position. So it was a very steep learning curve to learn about the culture, to learn about the system, to learn what things were permitted and what things weren't, really to understand how the businesses work, how strategy works in this environment. I've previously done some work in Southeast Asia, and that's a completely different mindset there. And Dubai is its own, country in a way. There is nowhere else like Dubai in the whole planet, I think, in terms of how business is done, because it's such a cultural melting pot. So it was quite a challenge to learn how things work. But then I also worked in Abu Dhabi, and that itself was completely different again. So probably more like Saudi Arabia, but Abu Dhabi has its own unique features as well. In Abu Dhabi, I was working for a project that was a PPP with Department of Health and Mubadala, and that was a healthcare technology project. So setting up the first health information exchange in the entire region, which is basically connecting all the patients' files in every hospital and clinic into a centralized, accessible record in order to improve patient safety and also to improve the efficiencies in terms of cost. So I've managed to see and be around a variety of projects, all of which were struggling in one way or another. And my role was to really try to stabilize the project and try and move things forward. And I guess, one of the key things that I've found in this region, well, it is because the culture is very tribal, and because there's such a mix of cultures here, and people are not permanent residents, there's not a lot of teamwork. People are very much individuals focused on their own outcomes in the workplace. There's a lot of very unhealthy politics in many organizations here that tends to paralyze a lot of companies here. I mean, this can happen anywhere in the world, but it's particularly common here. So actually breaking down those silos and trying to call a truce amongst the warring factions tends to be the first step of moving anything forward here, because things can rapidly break down into complete paralysis otherwise.
We've seen one of the things we've seen introduced here in the UAE in the last few years has been compulsory medical insurance. What sort of an effect from a business perspective has that had on the economic environment and the business environment from your perspective?
So this whole region is a trap for new players in the healthcare sector as well as the information technology sector. Nothing is ever what it seems. So, and this is a great question, because while there's compulsory health insurance, there is such a low minimum level of insurance, which is essentially almost non-existent, that in the end, still the majority of the population here effectively have no, I don't want to say no health insurance, but they have cover for emergencies and that's about it. So the compulsory insurance has not had the boom on the market the way that it was touted in the media and touted by the big four consultants and touted by even the regulators themselves, who are very keen on getting more investment. So anyone who's wanting to invest here or open a business or purchase a business really needs to get beneath the headlines and really look at the details very carefully, because what you see on the headlines and what you see in the hype, this wonderful positive news, which I enjoy, it has a downside to it in terms of that if you can't say the negative side, if you can't say the problems, then you tend to get a very rose-colored picture of what's going on. It's very easy to lose money here if you don't know what you're doing.
Well, from a business perspective, yeah.
Absolutely.
It's interesting, because I'm still insured in Australia, where I'm a resident, and in Hong Kong, where I'm a resident, New Zealand, where I'm a citizen, and here in Dubai, where I've been a resident for nearly 20 years. And I must say, whenever I've had cause or reason to go to a hospital or through the medical process here, which has been not irregularly. I mean, I'm getting on, and things tend to happen from time to time. I've been totally and thoroughly impressed by the speed, the efficiency, the accuracy, the diagnostic outcomes, all of the above. So it's, as you say, I've not been living in America for a very long time, but certainly things work here very well when you are under that insurance system, at least at a business level.
Oh, definitely. In terms of accessibility and speed, the system here is terrific. I mean, they've done a lot of good things here, and they've made a lot of improvements at a very rapid pace. and they're always looking on how they can do things better. Of course, there's constraints, and there's always some areas that you can't touch. But for the things that can be improved and things that can be optimized, it's always a goal. That's why I like Dubai in particular, is that at least it's a goal. Other places in the world, including my home country, it's not a goal. It's all about maintaining the status quo. It's not about actually trying to improve. So this is one of the reasons I'm in this region. I find it stimulating.
Well, that's a pretty good segue, actually, because I wanted to talk a little bit about the comparison between an extreme growth emerging economic area like the GCC, and certainly in particular the UAE, where we've both now got a fair bit of experience compared to Australia, where we're both residents and you're a citizen. I suppose one of the existential pervasive issues of life for us in the last year and a half now has been the whole issue of where the pandemic has met the field of logistics to a certain extent, or the logistics of managing a pandemic, both in the early days when the virus struck, to now where we're seeing this massive rollout globally, where logistics has never been, certainly in my lifetime, under the spotlight in the way that it is, logistics and supply chain, and nor either so has the medical profession, with people coming out of the shade to be seen as heroes, to be seen as lifesavers, the first responders, the people working in horrendous conditions all around the world, and of course now into the third and fourth waves of all of that. Talk to us a little bit about what the experience as a medical consultant, practitioner, and business person in the last 12 months has meant. What's changed in the landscape? What sort of impacts has it had on your thinking and the way that you operate?
Sure. So in terms of, I'll first of all talk about from the clinical side, and then I'll talk about the business and the logistics side. So from the clinical side, this time last year, I was back in Australia for a visit, and then I got stuck by the borders being closed. So I decided to work clinically just to help out, because, I had skills, and there was a pandemic rapidly evolving, and I wanted to do my part. And it was very challenging because there was so much misinformation and disinformation about the virus and about how it was spread and what we could do to protect ourselves. Many people didn't take it seriously. I was very fortunate that I had the correct masks, the N95 masks. By accident, I actually had a supply of them with me. I was doing a job here in Dubai with a lot of dust, and I bought a box of N95 masks because I was coughing because of the dust. And I just happened to have a supply, which I took home with me because early in the pandemic, I traveled home through Hong Kong. So I had a box of masks with me, and I used that one box for their entire 9 months. Which, I mean, these masks are meant to be lasting hours, and I was being forced to make them last months. It was very challenging. Patients would come in to see you. They'd be coughing. They'd be sick. They were convinced it was not COVID, but of course, they had no idea if it was or wasn't. I managed quite a few cases of COVID. I saw very early on the cases of long COVID, this terrible chronic disease that occurs in, perhaps 10% or more of infections, where people are debilitated for months or even longer. It's still going on. So the disease was rapidly, in terms of the knowledge was evolving. It became much more multi-system disease, not just a respiratory thing. And of course, the government and the health authorities kept changing their position, kept changing the rules. We were in lockdown for a while, a fairly strict lockdown. Australia's a very strict country. And watching the people sort of submit to that process, and watching the interaction between the government, the police, health authorities and the population was really quite fascinating and sometimes disturbing.
And they didn't always get it right, Ben. They
no.
number of outbreaks, complete mess of a situation where they thought they had things under control, just making schoolboy errors.
The problem in Australia is that because a lot of the system is government run, I mean, the good thing is that there's a very strong public health system, so they were able to do very effective contact tracing. The problem is, though, that all of the decision makers, including the doctors, the government doctors, are public servants. So they have no idea about the impact of their decisions on business, on employment. They have no idea whatsoever, and no real empathy for it either. So Australia took an approach of trying to eliminate the virus, and to a large extent, they've certainly suppressed the virus. Life's gone back to normal in Australia and New Zealand now, closely and not fully, in terms of restrictions. But in terms of the economy, it's far from it, because some places, particularly Melbourne, has had several long lockdowns, and the business has been completely decimated, completely destroyed. People are never going to recover. One of the options the Australian government gave people was to access their superannuation, like their pension fund. And many people withdrew money out of their pension fund early on. And of course, since then, the share market went up a lot. So these people have lost a lot of their retirement savings, which they'll never recover. So it's a very delicate balancing act between controlling the virus, controlling the death rate, controlling the rate of this long COVID, and then at the same time allowing economic activity to continue in some form. Australia went to the extreme of closing everything down, and it certainly saved a lot of lives from COVID, but the mental health impact, the economic impact has cost lives, and we don't really know how to balance that up yet. In contrast, when I came back to the UAE later last year, things were relatively open. There were restrictions. I thought they managed the pandemic very well here. Mask use was compulsory, and people generally were pretty good at wearing masks. For a very dense population, people were trying to do social distancing. There wasn't too much negativity in the news. There wasn't too much fear. In Australia, they have one new case, and it's breaking headlines, literally breaking headlines on all news channels. One new case has been found in Western Australia today. I mean, it's ridiculous, and it causes fear, which then stops investment and it stops new employment, and it paralyzes business. So it's not smart. The only problem that's happened in UAE, unfortunately, that the wave of infection in the UK just before Christmas came here because of all the tourists, and now we've gone from having like a couple of hundred cases a day to consistently 2,000 or more cases a day, which for a small country is a lot. And that number's not coming down. So, and we see that once this virus gets a foothold, it's becoming more and more infectious over time, that it's harder and harder to get under control. And just when you think that we've got it under control, I mean, India thought they had it under control, and now they're facing complete disaster in a fairly short amount of time. So things can rapidly spiral out of control. So speed is important, and that's generally where most places have failed, is they've been very slow to react, and they haven't prepared their crisis action to be fast enough to be able to really sense when things are turning around. Instead they wait for the numbers to get really bad and then they act. And what we know with the pandemic is by the time you act, the virus is already several weeks ahead of you, and you can quickly get to a point where it's too late. And that's what we've seen clinically. The other thing that's really interesting is, the initial infections in China, which caused a shutdown of several parts of China, really exposed the world's weakness and fragility in terms of supply chain. That all of a sudden, manufacturing of not just pharmaceuticals, not just healthcare, but in terms of IT and in terms of almost every industry, everything was starting to grind to a halt because there was always one critical component that was unavailable. Even the reagents, the testing material for COVID tests, one of the key reagents was all made in China, and we couldn't get it. So I think the key lesson out of COVID is having backup supply chains and not relying on this global economic model of comparative advantage. That countries need to manufacture their own essential products and can't just rely on getting it from another country, particularly China. It's even if it's a lot cheaper, you have to have another supply coming from somewhere else that's not China dependent. And I think it's really come to a forefront now in terms of COVID and also China in terms of this model of trade that now actually having a plan B and a plan C for your logistics and for your supply chain is super important, and it needs to be. You need to have drills about it. You need to actually practice it. You have to not just have a vague plan. You have to have a detailed plan and do practice scenarios of implementing that backup plan. So when the crisis comes, because there will be more crises yet, you're ready and you've got all your systems in place and you can continue your business. And this is where I think people have fallen down, is they're relying on hope, relying on misinformation, relying on fantasy that things are going to magically turn around. And that's not the case at all.
Yeah, well, I guess at least what we have now is in the US, we don't have the leadership talking about fantasies, and we have even though they're struggling in certain areas, certainly talking about facts and realities there now as a major country. But yeah, very sad with India, with what's going on at the moment. They certainly they relaxed too early by the look of it. And now they've got, as you say, a major disaster on their hands. One of the major upsides here that I think is recognised globally is the speed to which UAE has jumped into vaccination. I think we're somewhere in the 90s now, are we, percent of citizens with 2 vaccinations?
So I think UAE has done a terrific job with vaccination. I've had my vaccinations. I was so impressed at the system. It was just efficient. The people were extremely polite and helpful. It was fast. It was reliable. Really, they were doing thousands of people. It seemed like thousands of people an hour, and it wasn't like a massive workforce. Yeah, it was just efficient. They thought it through. And people were just getting on with it. They weren't bickering or complaining or doing politics. People were really working together. It was extremely well done. I mean, the UAE likes to be at the forefront of things. It likes to be the best in the world. It likes to, do things better than everyone else. And it's great to have that ambition. I think it's because it makes people, it makes the country strive to do better. And I think the problem we have is that there's still a few challenges in terms of vaccination. That we know that the vaccination saves lives in terms of reduces the rate of death, and we know that it reduces the rate of serious infection. So there are some benefits, but the vaccines do not stop transmission, and excuse me, and they don't stop you catching the virus. The other problem is not everybody gets a decent immune response to the vaccines. And some of the vaccines are a lot better at getting an immune response than others. So at the moment, the Pfizer vaccine is coming out on top in terms of being the most effective vaccine. Then I think the other mRNA vaccines are in that are equally effective. Not far behind is the Russian vaccine, the Sputnik vaccine, which has performed extremely well. AstraZeneca is sort of then in the middle range. It's effective, but it's not great. And then unfortunately, the Chinese vaccines are really coming a very distant last place in terms of the vaccine effectiveness, which is, some effectiveness is better than nothing. So, the people who managed to get Sinopharm or Sinovac vaccines around the world, it's still been at least 50% effective and maybe more in some cases. Sinopharm hasn't published any data anywhere in the world, so we've only seen headlines. But certainly having a vaccine is better than not having a vaccine. But we knew that these first wave or the first batch of vaccines would not be fully effective. So now the world's scrambling now we know the state of play in terms of which vaccines are most effective. We now know which ones to produce. And the challenge is now we need to make 10 billion vaccines to vaccinate the world quickly and uniformly. Otherwise, the virus will continue to mutate and it will escape the effects of the vaccine. And this is exactly what we're seeing now. So the usual human frailty of rich versus poor, the haves and the have-nots is happening with the vaccine. That of the total world's vaccinations that have been done, 47% has been done in high-income countries so far, and the developing world has only received 0.2% of the world's vaccinations so far, 0.2%. So we have no chance of getting on top of this virus while there's still international travel and traveling to countries that have had no vaccination with this wild virus mutating rapidly. These mutations will continue to encircle the globe, and they're becoming seemingly more deadly and definitely more infectious. So this COVID pandemic is far from over. In fact, it could still take a much worse turn than where we currently are.
Well, thanks for all those insights, and really do appreciate giving us those from a medical insights perspective. You may have seen on LinkedIn that we do polls, we do surveys pretty regularly, and they've been horrendously successful in terms of getting people to come back to us and give us feedback. So yesterday, I did a poll amongst a whole range of our clients, just very quickly prior to us speaking today. And I asked some questions for some insight, for some questions, some input from people. And the following questions have come up to me this morning, and I'm going to ask you those questions.
Sure.
And they may be questions, and I haven't vetted them, so they may be questions you feel comfortable or in a position to answer, or maybe not. But knowing you, I'm probably going to get an answer anyway. Okay, so here's one. People are saying the best case end of the pandemic is now 2022. What do you think?
So projections are best case is 4 years away, and it's probably going to be 6 years away. So anyone who's planning for a return to normal in 2022 is making a major business mistake. So there needs to be long-term plans in terms of your operations for your business. Do not expect that things will go back to 2019 way of doing business ever. This has permanently changed the business model throughout the world. By the time we're out of this, things are going to be unrecognizable.
Well, you're pretty consistent, because I recall about a year or a little bit more ago, after the pandemic had struck, I contacted you, and during a conversation that you and I had, I asked you, this thing could be around for 5 or 6 months, right? And you slam dunked me on the spot and said, Kim, forget it. This is 5 to 6 years.
That's right. It's very clear. If you look at what's happening around the world, there's good evidence to support that. Look at India. Now we're seeing Thailand getting out of control, and I think Brazil's also out of control again. I mean, don't believe the political spin. Now there's so much misinformation. Even the numbers are not always believable, but just look at the trends. Look at what's actually going on. And what we've seen is the epidemiologists have modeled this pandemic. This pandemic is following the pattern of most other respiratory, highly infectious viruses. And you see multiple peaks a year that goes on for quite a few years. So, and that's I saw this graphical representation a year ago, and I was horrified at what I saw. But it's exactly what's playing out as we're seeing wave after wave. And what we're seeing, unfortunately, is people are not learning because they're overcome with hope, and they're overcome with this fantasy that at the end of a wave, that's it, there's not going to be more. It's like going to the beach with a surfboard and thinking there's only going to be one wave. It's not the case. And the other thing that people think is that, so naturally we see this shape of a wave in terms of the infection numbers. And a lot of people assume that whatever interventions they've done are the reason why the slope's coming down. In actual fact, the curve goes up and down all by itself. So most interventions that people have done or countries have done have had probably almost no effect or very little effect. Yes, some things we know work, like quarantine and social distancing and masks. I mean, these things do help. But we tend to overestimate our ability as humans to control nature, and in this case, to control a highly infectious virus. And the natural pattern is that there's going to be waves, and that we can try and reduce the size of those waves, but the pattern itself will continue.
Amazing. Well, really appreciate that input. One of the other questions I've got here is the virus could migrate to cats and dogs, mutate, and then come back to humans. What do you think? Rubbish?
So there is some evidence that cats and dogs can be infected, but there doesn't really seem to be any evidence that humans can catch infection from cats and dogs. I mean, this virus, very strangely, has come out of nowhere, and it's highly specific for humans. Highly specific that it just targets the human receptors from this spike protein on the virus. This is not normal behavior in nature, that a virus suddenly appears that's incredibly specific for human genetics. So because of that specificity, the likelihood of it going to animals and being a problem is low. It's not impossible. But I mean, the animal that's of most concern are humans themselves.
Okay. Almost sounds, if I didn't know better, as if there's some degree of suspicion of some sort of engineering there, Ben, but I mean, that's probably not something you want to comment about.
I prefer to stay away from it. But a lot of things about this virus are not making sense, and a lot of information will come out in the future in terms of what I don't know. Maybe this is all a natural thing. Maybe we don't know, but it's certainly not behaving by how specific it is for the human receptors and for the human genetics. It's highly unusual.
Wow, that's interesting. You talked before about the wave, and I reflect back again to the case of Australia and New Zealand, who have made a name for themselves on how they've flattened out and tried to eliminate the virus. But it sounds like they've flattened out the wave to the extent where nobody can afford nobody's going to be able to afford the surfboard to get on the wave. Anyway, cutting that little bit of misplaced humour out. The other question is, how do you suggest we combat the virus in a large, densely populated country like India? What's the strategy for the government?
It's a big challenge to do that. I mean, the first thing, the ideal situation is to rapidly roll out a vaccine, and India has not done well at that. India has a good healthcare system,
even though they're producing a lot of the vaccines.
Yeah, they've not really vaccinated their own people very well. Why that is, I'm not sure. I think some regions have done a little better than others, but I think that India's vaccination rollout internally has not been what was promised, and I think that's a major reason for the failing this sort of far into the pandemic. That India is producing their own AstraZeneca vaccines, and they could have done better at vaccinating their own population. In terms of wearing masks, in terms of communication from the governments. India's health system has a lot of private health, and really this, if a country doesn't have a really strong public health system, and in terms of the pure public health, like in terms of immunizations and in terms of disease management, infection control, then these are the countries that have suffered. And the United States is another country. It's very much a private system. There's very small numbers of people employed in public health. And they've been the biggest failure of all countries in terms of managing the pandemic. Even if the politics were different, the actual public health systems themselves were nowhere near powered enough to deal with this. And I'll say as well, Kim, that medical people like myself, we've had pandemic training for more than 15 years. In my country, it was sort of compulsory to do pandemic training for years now. And I always looked at it as like, what's this bureaucracy, this wasting my time? And so full credit to the people who made that decision. They certainly knew that something was coming. The lack of public health in India is a problem. And I think education levels, and I also think that, the government approach and the communication approach is really important. And once you start to get the governments trying to cover things up or delete negative tweets, which has just happened in India the last few days, once you start to get a government operating in this authoritarian way, that means the communication starts to become dysfunctional, and people stop trusting and believing what the government says, and people take matters into their own hands. And I think that maybe is a factor as well. So in a dense population, it's always going to be difficult. But China managed it, so it can be done.
One sentence answer. How does Brazil sort itself out?
Oh, I don't know, revolution. I don't know. It's
rise up. The government's shown an absolute ridiculous approach to it.
Just overpopulation and too much poverty, too much gap between rich and poor. The system the last 20 years has really been about building new billionaires and billionaires getting wealthier and winner take all. And we've seen a huge gap now between rich and poor. We've seen the decimation of the middle class. And this is what you get when you destroy a community, which is what's been happening. That once we hit some potholes, once we get off that smooth freeway onto a rough road, the whole system breaks down.
Okay. Two other questions. One, I suspect, is from our global head of research, Andrea, who's based here in the Gulf. And her question, and bearing in mind she rides a electric scooter to work, is the public transport system safe to use?
Well, if you're wearing a mask, if you're trying to practice social distancing as much as realistically possible, if the virus numbers are not trending upwards rapidly, if it's a public transport system that you can open a window, because ventilation is super important, then it's you have to get on with your life somehow. You need transport. If you don't have your own transport, that you still have to get transport. So you can just take the precautions as best as you can and make sure you get vaccinated. So I think if you're vaccinated and you're taking precautions, then you have to get on with your life.
Awesome. Final question. As hospitals run out of bed space, are there any short-term substitutes for ventilators that patients can use to get oxygen or air in the meantime? And we're not talking about any particular country here.
Sure.
This country in particular has ample bed space and medical supplies. But for those countries who don't, and I think we're talking India at least at this stage, possibly Brazil as well, and others, are there any alternatives to putting people in a hospital and giving them oxygen?
There's not really. I mean, what we've seen with the virus is that once it overwhelms a health system, the death rate increases from 1% to about 10%. And that's what we'll start to see now in India. That's what we saw in Italy, and to some extent we saw it in the US and the UK. That once there's no more beds, once the oxygen starts to run out, once there's very few doctors and nurses because they're all infected, and this is really the critical thing that countries have to try and prevent. And this is the main reason for the lockdowns. This is the main reason for quarantine and border control. It's actually to prevent the health systems from being overwhelmed, because that's when you see 10 times increase in the death rate. People are always going to die from this. It's just a matter of how many and how many are relatively preventable.
Okay. Well, I mean, that's mindful of information, and I know our audience will be very pleased to be able to get this extra input from you, from somebody who's not only an entrepreneurial business operator in the area of medicine, but also a clinician, a physician, somebody who's practicing, it has been now for, I don't know how many years I can mention, but it must be about 30 by now, Ben, and
Getting up there.
Yeah, but your openness and candid feedback and answering of questions, I genuinely do respect and appreciate, and I'm sure our audience do as well. This is a horrendous issue globally. As I say, it's existential. It's everywhere. It's affecting everybody. Just before, I know you've got a practice to run today, but I just wanted to ask you a couple of quick questions related to the logistics sector.
No problem.
From your perspective, and you've spoken with erudite accuracy around the need for nearshoring and need not to rely on particular countries for supplies and one thing and another, and bringing the supply chains a lot shorter so that there's not such dramatic disruption to supply chains. If you could reflect on your knowledge on supply chains moving forward in the medical field and more broadly, if you like, what do you think some of the lasting changes are that we're going to see specifically as a result of this pandemic? You have talked about nearshoring more and getting closer to supply and things. Any other effects that you see for those in the logistics and supply chain listening today?
So I think logistics and supply chain, I can see it becoming part of the C-suite. I can see there being a chief logistics officer, a CLO, really coming to a really important part of the business. Because supply chain and logistics was always back office. It was it was a very unfashionable part of business that was done by people that were, didn't really get much respect or acknowledgement. But now I really think that supply chain is more important than marketing, and because if you can't get your products in to do your manufacturing or to deliver your services, then you're completely crippled. And I think there'll be a lot more expertise being developed on new innovation in terms of supply chain. And I think this is where using technology is super important. I think being able to track your supply chain is very important. And we have the technology now to do that. So you know exactly where your products are coming from and exactly where they are located. And being able to do that down to each batch is so important because things can get lost. And I think also in terms of supply chain and logistics, I think security of your valuable products is now really coming to the forefront. That if things deteriorate, and it's possible, I think we'll see theft of valuable suppliers. I think we're going to see the black market trade in some things. I think it's happening already. So I think securing your supply chain is important. Being able to track it using technology, being able to do predictive analysis using some of the newer forms of artificial intelligence. Be careful with that. But I do think that this is a way that the field will evolve. And also, I think doing supply chain from an office in a building in a central business district, I think those days are gone. Even from a warehouse to a certain point, I mean, some aspects of the role can be done remotely from anywhere. And I do think the supply chain and logistics industry needs to really coordinate together and really communicate with each other, maybe form an association or professional body, and really cooperate as a distinct group of professionals, rather than being just sort of isolated and being part of a company. I think actually forming a professional body and getting some standards and protocols and really trying to make the whole process more efficient and more accountable. I think this is the way forward. Because this problem is, we can't rely on the old ways anymore. That they're gone. We have to find new ways of doing this with less manpower and with more technology and much more certainty.
Right. Look, it's extremely interesting to hear, and I'm sure I'm not the only one on today on the show that's really interested in your perspective and your point of view, the way that you've interpreted what's going on, and I must say you're by far the most aware of supply chain issues of anybody I've ever met in the medical practitioner. So well done. You've obviously been exposing yourself to much broader economic influences and factors. And I know you've gained about 5 or 6 serious qualifications in the last 10 years, both from a business perspective as well as medical perspective. So I understand where that's coming from. Look, to wrap up, I guess you mentioned the way that the rise of, and I think you did right, logistics and supply chain now, I can assure you from the clients that we have in 13 offices around the world, last 22 years dealing with many of the top 1,000 companies in the world, both in logistics and supply chain. Logistics and supply chain roles are becoming much more influential in the running and in the direction of companies. But I guess here's something from my perspective is that with the knowledge that somebody like you has and the rise of the medical profession and its need and its requirement of from the world to guide us through this sort of situation. And as you say, it's just going to be ongoing to a certain degree for the foreseeable future. I personally would see medical people being usurped onto boards as well and into strategic positions in companies. And do you think there's much of a segue going on there? Do you see that's a future for people in the medicine field, in the healthcare field?
So I think it's a really good idea, and I think that should be happening. I think the smart companies will be at least consulting more to medical people like myself and others. And I think the real danger, though, is to be hiring yes people. Sometimes there's cases of doctors going into the corporate world and sitting in their corporate office and just ticking boxes and signing forms and agreeing to everything. So I think it's really important that there has to be really robust discussion. It has to be very frank and fearless about what's planned ahead and what some of the problems might be. Just having someone there to say we've got a medical person on our staff is not enough. They really have to utilize that person's knowledge, and they have to be prepared to listen to information that may not sort of fit their current mindset.
Awesome. So I suppose the final question from my perspective would be, and I usually ask this around for people joining the supply chain and advice from supply chain executives about young people or midlife people joining the supply chain. Let's talk about the healthcare profession and medicine in general. What would your advice be for somebody who's maybe graduating and they're not necessarily graduating with a medical degree, but that they have seen the vital importance of people in the healthcare sector and the heroism and the life-saving activity that's been going on, and they're motivated to become involved in that sector? What would your advice be as a level of entry and different ways of penetrating and joining that most noble of professions?
I think the healthcare has always been very supply chain dependent, and if you make a mistake in healthcare, people die. It's not just people. You don't sell something. People get sick and they die. So the supply chain in healthcare has to be very accurate, and has to be a lot of certainty. And the goods can't get contaminated. A lot of healthcare products are refrigerated as well. So I think there's good opportunities in refrigerated supply chain. I think it's a specialized area, but it's not that complicated to learn from a supply chain perspective. It's more the approach that it suits people who are, very particular about getting things correct and on time. And I don't want to say obsessive, but there has to be a certain level of attention to detail to do it properly. But the rewards are great. There's a lot of respect within the healthcare community for supply chain, particularly now. It's an area that's been done badly in the past and not been properly resourced. In fact, they had this way of doing supply chain called just in time. I don't know if that's in other industries as well or not, but I mean, that's any organization that had a just in time system supply chain, I think has already hit some major problems. So I think, really understanding where your supply chain, what the links are, where the vulnerabilities are, is super important in healthcare because it's complex now and rapidly changing and rapidly evolving. And it's not just only healthcare. I mean, so many of these fields are merging, healthcare and technology are merging, and healthcare and communications and marketing are merging. I mean, there's lots of crossover skills. I think there's someone worked in the healthcare sector that they could bring from other industries, and they could certainly use in the future in other fields. So I think if people are interested in doing it, I think it's a really good opportunity. Though I know there's a lot of need for it, because during the pandemic, the supply chain has just been so overwhelmed, like not just PPE, but vaccines and so many other things. And we've been overwhelmed by the pandemic, so the regular supply chain has sort of gone without the normal resources. So there's certainly opportunities for people to get into that field.
Right. Well, thanks again for the input, Ben. I really do appreciate you taking the time early in the morning. Dr. Ben Hanson, business leader, entrepreneur, clinician, physician, and disruptor. I think that certainly we could call you that, and one of the straightest shooters I've ever met in any field. Really do appreciate your input and your advice, and I'm sure I speak on the rest of our audience and those listening that we appreciate everything you're doing, that everybody in your field in healthcare and medicine, first responders, as we always say to everybody, stay distance, keep the masks on, wash your hands, and look after each other. Ben Hanson, thanks very much for coming.
Thank you, Kim. It's been a pleasure.